just really quick talk about the medical school application timeline. Very brief, just a summary. So depending on if you're in year 12 or year 11, you might begin researching the different medical schools. So we talked a lot about what types of things you might look for and their entry requirements. So their UCAT threshold or the grades that they require. Something that I want to point out is that different universities have different access and extenuating circumstances. So, for example, they might use your postcode, where you live, the school that you went to, your financial situation, if you have any disabilities. And I'd really, really recommend that you look at the universities, see what they consider. And just because sometimes UCAS doesn't catch everything, and sometimes you have to submit a separate application. So make sure you look at that. They can also give you reduced entry requirements, so they can reduce your UCAT score, or they might view your application a little bit differently. So I definitely recommend you do that. 10 open days, do that quite early on, because if you want to go somewhere far, you might have to travel a little bit. So have a look at those. And obviously, talking to the students that go there, as Alex mentioned before, that can be really helpful. I just want to go over quickly about work experience and volunteering or extra and super curricular activities. So, what do they mean by this? And it can be literally anything. It could be your hobbies, it could be whatever volunteering you do. So, for example, I worked at a charity bookstore. And what I talked about was interacting with the different customers that come in. So if it was children or if it was elderly customers that had visual problems, how did I help them navigate the store? And what you need to show is that you have an insight into what a career in medicine entails and that you demonstrate how you have shown the skills needed to be a doctor. And so I've got a list of things that you should be able to demonstrate. Um, and it's okay if you don't think you match every single little point. But what you need to show is that you are working towards building these skills, which is much more important. And that is what they are looking for. So, for example, motivation to study medicine, ability to reflect on your own work is a massive, massive thing. Organization, problem solving, honesty, teamwork, empathy. So, these are all the types of things that they are looking for when you talk about your work experience and you talk about your volunteering. It doesn't matter if you've done a month in a hospital every single day, or if you did a day in a GP surgery. If you're able to reflect on that experience effectively, that is how you show that you got the most out of the opportunity rather than saying, I've done this amount of work. And something that they bring up a lot, especially in my medical school, is the Gibbs reflective cycle, which can be a really good way to reflect on your work experience and record your work experience. So if you describe what happened, what did you do? How were you feeling when you did that experience? Was it a good or a bad experience? What else can you make of the situation? What else could you have done? And an action plan. So if the situation happened again, what would you do again? Or what would you do differently? Or what would you do the same way? And it's really important that you reflect on the situation and you see, okay, this happened, and maybe I'm going to act in this way to avoid that from happening again. Or this is something that I did really well and it's worked, and I'm going to continue to do that. Make sure you record all of this. So, as Alex said before, put your date, make sure you put all the little details, just so that when it comes to your personal statement and your interviews, you have something to go over and that you know, okay, I'm confident that I can talk about my work experience effectively. Because once it gets to the interview period, sometimes you can forget all of the things that you've done, but just make sure you keep a record of everything you've done. Um, so when it comes to registering for the UCAT, this will be from May to June. So if you're doing it this year, you might have already done it, but make sure you book early, as Sarah was saying before. And then between July to September, you can take the UCAT exam. So if you feel like I want to take it early and I just want to relax the rest of the summer, that's okay. If you feel like you need a little bit more time to prepare, you can do it towards September, and that's okay. When it comes to writing your personal statement, they have changed this a little bit. So instead of a big, long personal statement, they put it into chunks and just questions. And this can be a really good opportunity to reflect on your experiences again. What is something that is important to mention is that a lot of universities don't necessarily look at the personal statement. This can change from university to university. So make sure you have a look. at what the university requires. I know that UCL did not look at the personal statement at all. They just said use it as an opportunity to reflect. But some other universities that use a panel style interview can go quite in depth into your personal statement. So therefore, look at the universities that you're applying to, see how much weighting you need to put on it. And yeah, and then finalizing your medical school choices in about September, submitting your UCAS application around mid-October, and then you'll get your medical school interviews. So there's different types of medical school interviews, and I think we'll go into a lot more depth about this in the later sessions. So you have panel or you have multiple mini interviews. And something that I would recommend doing from now is make sure you read academic papers, maybe read some books around about being a doctor or around an area of medicine that interests you. Stay up to date with the news. So I remember when I was applying, I was looking at BBC Health, the news section, or BBC News, the health section every single day, just to get an idea of what's going on, what are the current hot topics. And also reading the British Medical Journal can be really helpful as it's a reliable source of information. I also send a list of the hot topics that are commonly asked about in interviews, and they do expect you to have a certain amount of knowledge about certain topics. So I'll send you that list of topics as well. So for example, currently a big thing in the news is euthanasia and assisted suicide. So definitely read around those topics. And then looking at the university's interview style. So as I said before, it can be panel or multiple mini interviews. And also another really good tip that I have is look at the societies that your university has. So, for example, I went to a KCL um, multiple mini interview workshop, and I went to a Imperial multiple mini interview workshop as well. And they basically did a mock interview for me, and I found that really, really helpful. So, if you go on, for example, Instagram, if you have Instagram, go and find the societies and the medical school that they have, and they often offer these mock interviews, and that can be really, really helpful when applying. Um, and then I've linked a website that has all the hot topics that are really relevant and that you should read about. And then hopefully you'll get some offers. And that's the end of my presentation.